G'day world, Chris Hogan coming to you live from the Sunshine Coast, and we're here for our Script Regional Innovation Tour, and I'm here with Adam Benjamin, who is the director of Medifarm. How are you, Adam?
Well, thank you. Nice to meet you, and hope I can help your lovely audience. I can't see them, but they're probably lovely.
They are, and I think maybe if you can see in the background, Medifarm doesn't really describe your product at all, but you're Australia's medical cannabis supplier, or Australia's leading medical cannabis supplier. Is that safe to say?
Well, that's right. We're the first licensed company in Australia to cultivate medical cannabis. And why we're doing this is to help Australian patients. You only need to go overseas. You go to countries like Israel, Canada, America. You go to very developed countries. You see patients and their equivalents in Australia who must have access to the best in medicine. And what we're saying as an Australian company with the global pioneers as partners, we must deliver leading information, leading science and leading medical cannabis to Australian patients. This is another tool in the doctor's bag. We are not saying to doctors, we want to replace your tool bag. But if you talk to a tradie and you say to a tradie, hey look, we've got this amazing tool, it's called a screwdriver, you don't always need to use a hammer, but it's up to you, you're the expert. So at very least, the doctor must know the most about his new tool, the medical cannabis.
That's right. And doctors in Australia can actually prescribe this for certain conditions now. As of what year or date?
Well, look, it's right. So this is the easiest way for any of your audience to think about this, be them patients, prospective patients, interested people, or doctors, is this is a prescribed medicine.
Yes.
You go to your doctor, they write a script, you go to the pharmacy, the pharmacist should be able to dispense this medicine. Behind that, of course, and perhaps your viewers again have heard a lot about this, it tends to get a lot of press. Behind that is the process by which you, the patient, would go to the doctor and the doctor would seek government approval. But I think what's great about this industry and why Australia will lead the world, remembering that right now it's a $70 billion global market, Australia will lead the world because not only have we got the right framework, the right federal framework in place, which also allows for export, but we already have an excellent reputation for healthcare, very advanced healthcare, very high standards, and exceptional agriculture. And those are the two major industries that collide, healthcare and agriculture. And if you've got a great reputation in those two, plus really the best legal framework in the world, it's only a matter of time. Not only will you lead the world, but again, why we're doing this is to help the patient, and we have a duty of care not just to help the patient, but to deliver the best medical cannabis to help the patient.
And I agree with you. It's important to recognise that this is a medicine, not a drug. Mm-hmm. But to answer one of my past questions, what are some of the conditions which people are able to get it prescribed for?
Well, look, it is it's a good question. Firstly, the Australian government has decided that there are a handful of conditions: epilepsy, palliative, so for those who are dying and who need relief, pain management, so chronic pain, sclerosis, multiple sclerosis and other spasticities, muscle spasticities, and also the side effects of some of the cancer therapies. So say a patient were going through chemo, they often experience vomiting or nausea and some of the other, loss of appetite. And this medical cannabis has very good evidence across the world. We're talking, of course, you need clinical evidence for doctors to prescribe this for those conditions. There are, excuse me again, there are a range of other conditions. One of my strong passions is for PTSD, post-traumatic stress disorder, and in particular, not only for returned servicemen. I don't know anyone with PTSD, but I do believe that not only returned servicemen, but particularly emergency services in Australia, they do an amazing job, really an amazing job. And our way of life in Australia is It's unprecedented. You only need to travel overseas to think how good it is in Australia. Now, medical cannabis works particularly well in PTSD. Our exclusive partnership with the pioneers from Israel, where Israel has mandatory military. I think most of us know that the Israeli army probably does a pretty serious job when they have to do their jobs. And they've had to come up with other solutions for PTSD. So my particular passion, although the Australian government hasn't yet put it on the list, we see that in Canada, the Canadian government subsidises their veterans in using medical cannabis. So I just believe that for those doing an amazing job in our community and in the rest of the world for our community, we must help them when they come back as well.
Absolutely, mate. Bang on. And I'm with you on that one. And so it's not a smokable product or a vaping product. It's providing an oil, although you could vape the oil, I suppose, but it's meant for consumption because that has the most, I guess, evidence to support that, you know, it's medically beneficial. Is that correct? It is correct, and I guess, and I'm not a doctor either, so I appreciate how you're trying to that. It's the way you administer the products. We all know pills. So in this case, the Australian government has said yes, oil, that's fine. In states like Queensland, you can sell the flower. You can sell it. It's not permitted to be smoked. So we're not talking about a smoked product. It's an oil. You don't get high. We see in our partners' company overseas, and bear in mind they've been doing this for well over a decade, they are now treating babies with epilepsy 2 weeks old. So obviously those kids are not smoking it and they're not getting high. This is just another amazing tool in the doctor's bag. So what's amazing, I guess, for us as a company is to be able to bring what we see is working effectively in certain cohorts overseas to the Australian patient, so that you can walk through our greenhouse, you can look at plants that have been bred exclusively for epilepsy, other plants exclusively for chronic pain. It's quite amazing. It really is. Yeah. I feel very privileged to be able to be part of this journey, and yet it's not surprising this stuff works, because for a lot of your viewers out there, and even those viewers who may be doctors, after a while, if you start talking about too many conditions, someone will say, but that sounds a bit like snake oil. How could it possibly do your arthritis and then it's also doing the... So what we have to understand is up until 1937, this was the most widely prescribed medicine in the world. So in 1937, the US government and a few other, international organisations said, we're going to group it all together, we're going to call it recreational, and we're going to prohibit it all. The doctors at the time, the American Association of Doctors, went ballistic. It would be the same as saying doctors to doctors today, we understand you like opiate medicine and it's very effective for certain patients, but we believe that's all heroin and we're just going to cut it all out. So it's the same. So it's not surprising that 80 years later or 85 years later, when medical cannabis re-enters the medical world, that it works. It's just that now, as companies and universities and hospitals, our job is to provide sufficient evidence for sufficient conditions so that patients have access to regulated medicine. Yeah, and so it's a non-THC. It's a CBD oil.
The answer to that is a bit complex, right. But essentially certain levels that you're talking about, THC most people know is a psychoactive ingredient. It's the levels of these things that are either there's no effect or there is an effect. So
and so that would be, so therefore doctors and specialists potentially have a product or multiple products in your range that they can select from depending on the actual treatment. Is that?
That's right. That's exactly right. So we try and make, so right now, although everyone gets excited and it's a bit James Bond about our facility and what are we growing in there, really we've got to remember that the greatest strength in this industry is the patient. We are in the business of helping patients, and the gatekeepers, those credible gatekeepers, are doctors. So in order to help the patient, we've got to help the doctor to help the patient, and we do that with education. So although you've very quickly worked it out, you can look at the genetics and you can start to discern which genetics are worked out for which conditions and backed by which evidence. But it's very exciting. It's very exciting because there are 100,000 Australians at the moment, and this is the federal government statistics, 100,000 who are going to Byron Bay or Nimbin, the black market of unregulated whatever's being produced, and they are waiting for regulated medicine. So it would be the same as saying to you, well, you're going to get Panadol, but you'll have to go to Nimbin to get your Panadol. You might think, well, you want it, but you really need a regulated, and that's what Medifarm Medical Cannabis and certainly the Australian framework that the government has set. Although it's lovely to talk about Medifarm, it's very flattering and whatnot. I think for any of your viewers out there to think, well, okay, this is great, and hopefully, of course, if they're patients, we can help them. But really, Australia's going to lead the world because right now we do have the best set of laws. And I think you sort of correctly identified that this is a medicine. So we haven't talked about any other aspects of it, recreational or industrial. And by holding that debate pure, by holding it at this is a medicine, it keeps the story very clear, very clear.
It's definitely for treatment of conditions that obviously different patients need obviously different kinds of help, and you've got the products to support that. And so how do people, I guess, stay across, there's lots of stuff happening in the media about this. It's sometimes difficult to discern whether or not it's coming out of Australia or coming out of any other country at the moment. But how do people stay across, I guess, the laws, how they maybe seek prescription? Are you publishing Australian, I guess, news on that, and where are you publishing that?
Look, it is a good point you raise. Obviously, look, please to any viewer, visit medifarm.com.au. We would be delighted to assist just with information, really, because what's interesting is we're kind of living in an era of disruptive media. You've set up this great camera, and you're rivaling media out there. Disruptive media, disruptive also. This is disruptive healthcare. This is where you, the patient, see someone or your equivalent overseas being helped with a product that is now legal in Australia. You get to go to your doctor forearmed with more information. So, of course, please visit medifarm.com.au. We do medical symposiums. We work with universities and hospitals. So we'll have product available by Christmas this year. And we have a facility here in Australia on the Sunshine Coast. It's the first licensed facility in Australia to bring that to market. And it's very exciting. So the information, of course, proprietary information you can get from Medifarm. For any viewer or doctor out there who's also listening, I would suggest visiting the Office of Drug Control. That's a Department of Health federal government department who issues the licenses. As you rightly pointed out, there's a lot in the media, and there's probably even more noise in the media. So for any of those people wanting to know, well, what's the real substance behind this? Who is licensed? Who is local? How do you get involved as a business, or how do you get help as a patient? You would go to the Office of Drug Control, or if you're a patient, really go to your state health department. So it's an amazing opportunity now to either be involved or hopefully be helped.
Fantastic. Thanks very much for your time, Adam.
Pleasure.
Thanks very much for watching, guys. Plenty more coming to you live from the Sunshine Coast on facebook.com/Beach City Life. Cheers. Thanks for watching.